Doctors of Reddit, what's your thank god they came in for a second opinion moment? I have a story of a friend who was severely mismanaged. I've probably posted it before, but I'm too lazy to look. For 2 years, my friend had been going to her GP complaining about migraines, bouts of severe vomiting, and dizzy spells. Every time, he would order blood work, then tell her she was fine. One morning, she woke up, and after a 6 morning with her husband, could barely stand. She was so dizzy, and had such a bad migraine. She told her husband not to worry, sent him to work, and had her neighbor drive her to the emergency room. She doesn't remember arriving. When she got there, she started acting erratic. They had to sedate her, and sent her for a CT scan of her head. There, they noticed a huge mass in her brain. The hospital wasn't equipped to deal with that, so they sent her by ambulance to the nearest hospital that could, a 4-hour drive away. This hospital immediately sent her for an MRI. It wasn't a mass. They could actually see the mass growing as they did the MRI. No, she was having a massive stroke. She was immediately taken in for surgery. They put in a stent and had to remove most of the left side of her brain as it was all dead. Afterwards, she was in a coma for nearly 72 hours. They were uncertain if she would wake up, and if she did, if she would ever recover. Thankfully, she did. It took almost a year of physio and speech therapy among a few others, but she has made almost a complete recovery. They even had their first child 8 months ago. Turns out, she had incredibly high cholesterol. With all the blood work that was done, her GP should have caught it. When she confronted him, he told her that her diagnosis was wrong, that she hadn't had a stroke, and had made it up. She went after his license. I've had a couple of gems, but the one that really sticks out in my mind actually happened about a month or so ago. A young mother brought in a 6-year-old to emerg. She was super nice and apologetic because she thought that she was wasting my time, because she said that her son had started to develop different spots all over his body and she has no idea why. My initial first thought was chickenpox, so I had some swords and shields up ready to go for the anti-vax debate, but she claimed that she had her son vaccinated at all stages up to that point, and upon closer inspection they were massive clusters of warts. Not uncommon, but because of how rapidly that they were growing, I ordered some blood work to make sure there wasn't an underlying cause, as kids' immune systems are pretty well equipped to handle that sort of thing. And I'm really glad that she brought him in, because he had a severely low white blood cell count which revealed a primary immune deficiency disease. This is my second story to post here, but a great story no less. Mid-30s man walks into my office with what looks like a black eye and a broken blood vessel in the front of his left eye. He went to his primary, and it was simply assumed that he got punched or hit or something, and he was dismissed. He was noted to have high blood pressure, but a script for medicine was written, and a follow-up in a few months. Gentleman comes in to see me to get another opinion on the matter, and I look at him and immediately start the line of questions. How long has it been there? Do you have a headache? And when you plug your ears with your fingers, do you hear a whooshing sound? He had a cavernous sinus fistula CCF. I sent him directly to the emergency room with his family of 4 in tow, and he was in there, or within an hour of arriving. Saved his eye and possibly his life that day. The best news, he was a kitchen guy at my local diner which I frequent, and they still treat me like royalty there when I come to eat. They all remember the time I saved one of theirs. This guy was told he had pink eye. He had metal shards in his eye from welding. This is a I wish I had gotten a second opinion story. I had a doctor in high school who wasn't concerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially and lost 60 pounds for no reason. It was only a year or 2 later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class, that he thought there might be something wrong with me. MRI ordered. Brain tumor found. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected, and she would have died. Thank goodness she went to the clinic. My dad, a pediatrician specializing in neuro issues, was seeing one of his patients at the hospital, got dragged into the NICU unexpectedly by a nurse who insisted a baby wasn't well. The attending doc insisted the kid was fine and just tired from a difficult vacuum assist delivery. My dad could tell the baby wasn't okay and managed to talk the parents into a brain scan. The NICU doc insisted my dad was nuts to the parents. Dad was right and the kid had a brain bleed and was rushed to surgery. The baby would have died without the nurse bringing my dad in and the parents listening to him. As is, that extra time almost certainly cost brain function. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I'm an internal med document. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did examined he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump, and he said yes, but the other doctor told him it was normal. Edit, he lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Edit 2. For those of you who are concerned after examining yourself, there is a small soft area posteriorly that should be similar on both your testicles known as the epididymis. That is normal. A hard lump on only one side only is not. Monthly self-checks between ages 15 to 34 can be done, but since rare 0.000 not a general recommendation. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180. Energetic and happy. Edit. Here's another one I thought of though a bit more sad, but also good at the same time. Here's a cautionary tale why urgent cares should never treat eye issues. Lady was referred to me after 2 weeks of treated for a red painful eye. The PA and MDs that saw her tried allergy meds and antibiotics thinking it was allergic or bacterial conjunctivitis, or hoping it was mild viral that would resolve on its own. So I took one look at her and knew it was a herpes simplex infection in her cornea. She was in pain and had been mistreated for 2 weeks. Got her on antivirals, but after discussing how it was odd she didn't have any active herpetic sores, but had a really bad cough that the said was just pneumonia and would go away with antibiotics. I told her to get it checked with a pulmonologist because it didn't sound like pneumonia and it wasn't getting better. I saw her 3 months later to monitor her corneal appearance and she came in using a wheelchair. Turns out the pulmonologist was blown away that the had dismissed her. She had a really rare small cell lung cancer. The reason the herpes infection manifested in the first place was her immune system was compromised. She told me the pulmonologist said I'd saved her life because they caught it early. It's been a bit over a year. She's still undergoing treatment, but her spirits are strong and she's optimistic as is the pulmonologist. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Not a doctor, but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers, and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. Had a patient come in for therapy after his PCN yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. Edit. 1 Thanks for the silver. You all rock. A nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the document. We suddenly and unexpectedly got a cardiac patient. In an emergency medicine doc in the Midwest, use of patient was transferred from rural nowhere to our tertiary care facility big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest x-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better and wanted to send him to us. Sure, send away. An hour later the gentleman arrives and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The x-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. From the time I was 13, I had a growth on my thumb. It became so big that it affected my piano playing. I went to the doctor about it, and he diagnosed it as a wart that had been there for nearly a decade. He used acid on it. That hurt, and did nothing. He used an electrical instrument to burn it. That really freaking hurt, and again did nothing. I moved to the UK and was at a dinner party a friend was hosting. She was a nurse, and many of her friends were nurses and doctors. One of the doctors, a surgeon, saw the wart on my thumb and became very excited. He called to his wife, a nurse, to come see. He told me that he couldn't diagnose me because I wasn't in clinic, but to make an appointment with my GP. I did, and was diagnosed with a neurofibroma, a type of tumor that develops around a nerve. I had surgery to remove it. It was the size of a lima bean. Thankfully, it was benign, but no wonder the wart treatments hurt like a Sonoma beach. A bit of background. In my field of audiology we have people licensed to diagnose not only hearing issues, but balance disorders and other factors impacting listening and understanding. We also have another field who popped up when it was not considered as ethical for us to treat those more serious hearing issues, i.e. with hearing aids, but they don't need the same doctorate level training, just barely high school or some college depending on jurisdiction. So I had a patient come in with a serious difference between left and right hearing, and this in itself is considered a red flag because both ears are exposed to the same things over time. And there are very few explanations as to why one would get so bad. The patient could hardly understand words on that bad side and the better ear was pretty good overall, just minor hearing loss, perhaps age related. Immediately upon seeing these test results, the ENT and I agreed to send this patient for an MRI of the head because something was off. The patient confirmed no MRI or medical treatment had been recommended in the past and only hearing aids by this lesser trained hearing aid dealer working for a popular US chain. The patient had been wearing these hearing aids already for a few years. The MRI results came back. Massive tumor on the hearing nerve. The hearing aid dealer is being investigated currently for malpractice, or more specifically a violation of state laws regarding red flags. Edit. Since a few of you are asking what happened with the patient, I'll paste what got buried below. I don't usually get to see these cases if they get sent for surgery. I'm not in a big metro area, so the very specialized ENT neurologists have their own audiologists to handle post-op testing. Anticlimactic, I agree. I'm not a doctor, but my father was told a few years ago that he had bladder cancer. They were going to have to remove the bladder and some other bits and pieces, and that this doctor just the guy to do the surgery for him. They started talking to him about where he wanted his port installed for his piss bag. That was the first time I remember seeing my dad cry. Luckily he has several clients who happen to be retired doctors and have become good friends over the years. One of them took it upon himself to review the tests and recommendations and told him that the doctor who recommended the surgery was either mistaken or lying to get himself more work. He went with my dad to several appointments with other doctors, and in the end they were able to treat the cancer without removing any organs, and it has stayed gone for several years now. My dad has a much better quality of life than he would have if he had listened to the first asshole and doesn't have to walk around with a bag of piss hanging off of him. We are also grateful to his doctor friend who stepped in to help. Wife went to her for pain in her pelvic region. Ultrasound showed a mass. Probably an ovarian cyst, they said. It will pop in time. Leave it alone. Went to TH doctor about a week later. Had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer free, but WTF. Can I go ahead and speak on behalf of my doctor? 19 meters at the time, 33 now. I felt sick for about a week. Flu-like symptoms. Didn't want to eat. Just felt bad all over. One day at work I feel a very uncomfortable cramp/tear in my abdomen. So I go to one of those 24-hour clinics. At this point I'm slumped over. Can't stand up straight without insane amount of pain. Just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones. Go home, drink fluids, sleep it off. This seemed fine to me. I was ready to go home and listen to the doc. All was good. But my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER. Against my wishes, of course. After a few minutes at the ER, they determine my appendix has ruptured and am going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6 to 7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. Edits, more info, medical terms, etc, etc. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. Around 1 AM, I was screaming on the floor. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis.